The only health care I really got was emergency rooms when my throat started to swell shut. I had no control. I had no control of any kind. And so I lived at the mercy of this illness. And then on top of that, I lived at the mercy of a healthcare system who didn't want me to get well. There comes a point where you just can't stay silent about this anymore. It's too important to not say anything. I'm Rachel Wall. I'm a baker here in Denver. And I started working with CCHI about 4 years ago when the bills were going through to try to overturn the ACA. I was born with a pre-existing condition. I was born with a rare genetic disease and started experiencing symptoms of that when I was 6 hours old. So I was 6 hours old when our healthcare system started trying to teach me that I didn't deserve to be healthy because that's too expensive. So even when I was a kid on my dad's insurance, claims were frequently denied on the grounds of pre-existing conditions. Treatment, medication, even surgeries had to be delayed. When I graduated college, I couldn't get health insurance at all. I didn't even try to access health care of any kind. It was far too expensive and completely out of my grasp. And then the ACA was passed, and all of a sudden, the treatment that I had needed for my entire life was available to me. And I was protected. I couldn't be dropped from my insurance because of a diagnosis. With access to health care, I went from so underweight, so unhealthy, can't breathe, I couldn't even get up a flight of stairs, and gone from that to just thriving, and I have a career that I love, and I do long distance triathlons and just really live, and I have control of my life, and I can be a person. I know that for as long as it is necessary, CCHI will continue to fight for everyone's right to health care. Organizations like CCHI that really just work person to person and do whatever it is that you as a specific person need, and are willing to listen and brainstorm and figure out what individuals need on an individual level it's so crucial. It's revolutionary. And maybe it seems like, oh, it's just one person, it doesn't matter. I'm one person and I matter, and you're one person and you matter. CCHI has just really empowered me to feel like I have a voice, and to believe that my voice is worth hearing.
Without CCHI, I mean, we couldn't have navigated this complex system, and we would have been on the hook for over $100,000 worth of bills. Yeah, it saved us from going bankrupt. Hi, my name's Melissa. Well, my husband had gotten in a bad bicycle accident on the trail, and they had to wheel him out of the woods on a stretcher. Well, he got great medical care, but afterwards we received gigantic medical bills, over $100,000. And we ended up looking online and through forums, asking what are the options? What do we do? And several different people had recommended contacting CCHI. Luckily, we found CCHI, and they helped us to go back to the insurance and filed a complaint with the Colorado Department of Insurance, which I wouldn't have even known to do. If you said you've covered the maximum amount, so now prove it. So they were paying $30,000 of $110,000. They went back and they said, actually, that wasn't the maximum amount. So now they're covering the whole thing, and all that we're having to pay is the maximum out of pocket. It was just absolutely amazing what CCHI was able to do with us, and their team was so helpful. I think CCHI's work is super important because it's keeping the insurance accountable. If CCHI wasn't there to make them comply with the laws, but and know how to fight back, people like us would have just fallen victim to the insurance companies.
Mark and Eric were 1 and 2 pound preemies. When they were 11 months old, our private health insurance called and said, "You're a month away from your lifetime max. What are you going to do next month to keep your kids alive?" My name is Kelly Stallman. I'm a parent advocate, and I've been involved with the Colorado Consumer Health Initiative since 2003. My husband and I have 3 sons, including twins with profound cerebral palsy. Colorado had the highest out-of-pocket expense in the country for children with special health care needs. We bought the most expensive health insurance on the market, and we were afraid we would be living under a bridge because we couldn't keep our kids alive by ourselves. We began learning about Medicaid and that kids are eligible if their medical expenses exceed the parental income, if they're severe enough for long-term care, that was a possibility. A few years later, the state budget was going to cut the program. There was no good answer except to save Medicaid and to coordinate private health insurance and public health insurance. Private insurance paid everything that they would pay, and then Medicaid paid the balance. Our lives depended on it. Mark and Eric were born too soon, and they passed too soon at 22 and 23, but they lived 100 years in their short lives. They were advocates to the core, and a lot of that was through CCHI. In many ways, CCHI became an advocate for our family. And it mattered to our family more than words can say. I want to thank CCHI because you really mattered to us. What a gift to our state and to our citizens that consumers matter. And it is about quality of life and quantity of life and not just about the bottom line. They literally changed the shape of healthcare in Colorado.